Welcome back to our channel, dear subscribers. We're glad you could join us. Let's dive into today's topic. Consider this for a moment. How important is health in our lives? The significance of health, it seems, is often only realized when we encounter adversity. Many of us, in the hustle and bustle of life, tend to take our health for granted until something drastic and life-altering takes place. Let's illustrate this with an example. Imagine a close friend, someone you've known for years, who recently mentioned feeling slightly off and experiencing what they thought was a harmless bout of indigestion. A few weeks later, they shockingly find out that what they presumed to be a simple stomach bug was, in fact, a silent heart attack. It's a frightening thought, isn't it? Suddenly, what seemed like a minor inconvenience grew into a potential life-threatening condition. Silent heart attacks are both enigmatic and dangerous, often leaving their victims unaware of their occurrence. These heart attacks, though silent, are no less harmful than their louder counterparts. In this segment, we will be decoding the elusive signs that often go unnoticed, exploring their causes and understanding measures to prevent them. Today, we delve into the mysterious world of silent heart attacks, exploring their elusive signs, causes, and ways to prevent them. A silent heart attack, or silent myocardial ischemia, isn't the typical heart-stopping scene we are accustomed to see in Hollywood movies. It isn't an attention-grabbing event, the kind where a man suddenly clutches his chest and collapses on the ground. Instead, it subtly creeps in and often goes unnoticed. Unlike what most people perceive, it isn't accompanied by a sudden wave of intense chest pain or a dramatic gasp for breath. The silent heart attack is a silent menace, a stealthy predator that seldom announces its arrival. It's the kind of heart attack that bypasses the tropes and slips under the radar. There's no chaos, no frantic rush to, and no immediate indication that something is terribly wrong. Hence, it is often underdiagnosed and undertreated. Research and studies have brought to light that nearly half of all heart are silent. This statistic is a startling revelation. It points towards a significant number of people living with a potentially life-threatening condition, unaware of its existence. Moreover, it has been observed that women are more susceptible to silent heart attacks. The reasons are not fully understood but could possibly be related to hormonal differences. The symptoms of a silent heart attack can be so slight, so subtle, that they might be easily mistaken for minor health problems. It's not uncommon for people to dismiss them as mere discomfort or an insignificant ailment, not realizing potential danger they are in. It's a silent killer, hiding in plain sight, waiting to strike when least expected. This makes the importance of regular checkups and monitoring heart health more crucial than ever. Even the slightest discomfort or deviation from regular health patterns must not be ignored. But what causes these silent heart attacks? This question has puzzled medical professionals for years, but the prime suspect is a condition known as atherosclerosis. This disease is characterized by the accumulation of plaque in the coronary arteries, which narrows down the passageway for blood. In due course, the plaque buildup may lead to the formation of blood clots, which have the potential to completely block the flow of blood. When this happens, the heart muscles do not receive the oxygen that they require for functioning effectively. This lack of oxygen causes them to lose their pumping capacity, thereby leading to a silent heart attack. There are several risk factors for this condition, most of which are lifestyle-related. Unhealthy eating habits, tobacco smoking, and high levels of stress can all contribute to the development of atherosclerosis. Additionally, individuals with type 2 diabetes are at a higher risk. However, some risk factors are beyond our control, as genetic predisposition or family history, the occurrence of conditions like preeclampsia during pregnancy, and advancing age. In the UK, there are over 30,000 out-of-hospital cardiac arrests a year, where emergency medical services attempt to resuscitate the victim. However, the survival rate is low. Less than 1 in 10 people in the UK survive an out-of-hospital cardiac arrest. This is not just an isolated fact. It's a scenario that's being replayed incessantly in homes and workplaces across the nation, casting a dark shadow on our collective health narrative. Yet, amidst this bleak reality, there's a glimmer of hope. Our bodies, miraculously engineered and intricately woven, are far more intelligent than we give them credit for. Do not simply capitulate in the face of a looming health emergency, but rather, they attempt to communicate with us. They emit signals, subtle yet distinct, which serve as clear indicators of any potential health issues. These signs could be as subtle as persistent fatigue, unexplained discomfort, or even an odd sensation that something isn't quite right with your health. They might seem inconsequential at first, but might actually be your body's distress signals, its way of view of an imminent cardiac event. Arming ourselves with knowledge about these unusual symptoms is an important first step. The more familiar we are with the potential signs, the better equipped we are to take prompt, decisive action. Opting for preventative cardiac care isn't merely a proactive health decision, it's a life-saving one. By recognizing these signs, promptly seeking medical attention, and taking the necessary preventive measures, you hold the power to deflect this towering health menace. You have the ability to prevent a major health crisis. So, what are the signs of a silent heart attack? The British Heart Association indicates crucial symptoms that must not be dismissed. These can range from persistent flu-like feelings to unusual fluid buildup, and sweating excessively, even in a cold environment, are signs to look out for. A person might also experience heartburn or discomfort in the chest that can be mistaken for indigestion. For diabetic individuals, neuropathy might mask heart attack pain, making it harder to detect. Also, the pain can extend beyond the usual left arm to areas like the right arm, jaw, teeth, abdomen, and back. These symptoms, which can sometimes occur without the common chest pain, are important to watch out for. Fatigue, a sense of lightheadedness, and difficulty in breathing are also key warning signs. To diagnose heart attacks, doctors typically use a combination of electrocardiograms, kinetic scans, MRI, and blood tests for cardiac biomarkers. The severity of the condition often dictates the treatment plan. In many cases, this could involve the administration of blood thinners, the placement of a stent, or the performance of a balloon angioplasty bypass surgery. If a silent heart attack occurs, survival is a significant achievement. This stealthy event amplifies the chances of another attack by 35%, and it may potentially trigger a cardiac arrhythmia or a stroke. To mitigate such risks, lifestyle changes are imperative. The integration of regular exercise and a balanced, nutrient-rich diet is key. Additionally, smoking cessation, weight management, and the control of blood glucose, cholesterol, and blood pressure levels are all essential steps to adopt a healthier lifestyle. In conclusion, regular heart checkups are critical. They are a preventive measure that can save your life. Today's conversation has brought to light the silent yet lethal nature of heart attacks that often go unnoticed. This silent killer does not discriminate, taking lives abruptly. Heart health is not something to be brushed aside or taken casually. It requires keen attention and regular monitoring. You may not be aware of your heart, but it is there, beating around 100,000 times a day, keeping you alive. The discussion highlighted the significance of being proactive when it comes to taking care of our hearts. It is not just about eating right or exercising. It goes beyond that. It is regular checkups and keeping tabs on your heart's health at all times. When was the last time you had a heart checkup? Have you ever experienced a scare or know someone who has? Your story could inspire others to take action. Share your thoughts, experiences, and insights in the comments below. Let's continue this crucial conversation about heart health, an integral part of our overall well-being. Thank you for investing your time in watching our video on silent heart attacks. We hope that the information presented has been enlightening and useful to you. Knowledge is power, and we are here to empower you. We are committed to bringing you more content that educates and informs about health matters that touch our lives daily. We appreciate your support and would love for you to be a part of our community. If you haven't already, please consider subscribing to our channel. Your participation matters to us. Please feel free to suggest topics you'd like to see us cover in future videos. Your suggestions will guide our content creation, ensuring we provide information that is relevant and valuable to you. Remember, your health is your wealth. Let's continue to learn together, grow together, and support each other in our health journeys. Thank you and stay healthy. We've come to the end of our video, but it's not the end of our journey together. We're grateful for your time and attention. Remember, health, especially heart health, is not just about treating conditions, but also about preventing them. We hope that the knowledge you've gained from this video will help you stay vigilant, proactive, and healthy. Until we meet again in our next video, goodbye.